for our appointment. Our little buddy needs all his annual vaccines, so we've got rabies, distemper, bordetella, your just regular kind of routine things for your pet.
Shots. All
right, we're going to check it for heartworms. This little test right here. We run it here. It takes about 10 minutes or so. Make sure your pet is healthy, protected. Keep them on heartworm prevention. Do it.
His meniscus fixed. His immediately luxating patella snapped. He had to get those surgically repaired.
Dang.
I know. So he is pretty much remade.
He's like the bionic dog, the $1 million dog.
Pretty much. Just about what it costs. So, but he's doing really good.
That's awesome. Does he have to keep him on like carprofen or anything?
I don't think he's on anything. I mean, I'll talk to him and make sure he's getting around. No, the surgery was so good. He doesn't have to be on anything at this point. But usually dogs 12 and older do need some arthritis help. So we'll talk to him about that. This is Bisou is 12 years old, and really the only reason we're seeing Bisou today is for a physical exam, an annual exam, which is really important. Every year your dog needs to be checked because we need to make sure that your dog's healthy. So we do a complete physical exam, give shots, prevent diseases, and then make sure that there's no heartworms and that there's no intestinal worms. And that's just like you going to the doctor once a year. Very, very important. And especially at 12 years old, we're going to pull some blood and check for kidney problems, liver issues, pancreatic issues. So anyway, that's what Bisou is here for. And we're going to do a physical exam. So the first thing that we like to do is look at the eyes and make sure that the white part of the eyes are white. That's called the sclera. And the reason we check that is because this dog could have liver problems, and the only way that we know is by doing blood work, but also physically, the eyes would be yellow and jaundice. Have you ever heard that? Jaundice discoloration. Well, these eyes are nice and white, and so that's pretty normal. And I also look in the eyes and check for cataracts or lenticular sclerosis. This dog actually has some cataracts, and so she shouldn't be driving at night, right? No night driving, because that's when they lose their sight. And this dog also has pretty good periodontal disease, a little bit of plaque and tartar on the teeth. So we're going to talk to the owner about getting these teeth cleaned, because that's important. That leads to kidney problems and heart issues if you don't keep these teeth clean. I'm checking the lymph nodes right here in the back of the jaw. That's where you would check for lymph nodes. And if you feel anything like a grape nodule, that's an inflamed lymph node. There are also lymph nodes in the armpit areas and back here in the back of the legs. So she is fine. I don't feel anything weird. I'm lifting this up because this is how we check for dehydration. So if you lift this up and it pops back pretty good, then there's no dehydration. But you see how I lift it up and it takes a little while to return to normal? I don't know if you can see that. This dog's a little bit dehydrated, so we'll probably give her a little fluids, and we're going to pull some blood to see if we can figure out why. I'm feeling her belly right now to see if I can feel anything weird, like a growth or anything weird. Sometimes we can feel it, sometimes we can't. And I'm also checking her legs. She had 2 knee surgeries in the past, but she's getting around pretty good, so that's good. And we'll also listen to her heart. So these are things that we do when we do a physical exam, just so you know. And maybe you can try to do this physical exam at home yourself. And if you notice something weird, give Dr. Danny a call. Give me 15 seconds. Heart rate is 60 to 180. And if you count the beats every 15 seconds and multiply that by 4, you can actually tell your own dog's heart rate and make sure that that's normal. We also check the temperature, and what was it, 90, did you do this already?
Oh no, that's a new thermometer. That's just a sticker on top.
Oh, nice. Yeah. Was it? I was like, oh, that's kind of low. Right. Yeah. So we're going to start with a new thermometer that's nice and lubed with a little Vaseline. And the normal temperature is 99.5 to 102.5. So this is something else you can check at home, just to make sure that your pet's okay. So we did heart rate, 60 to 180 per minute, 60 to 180 beats per minute, and temperature is 99.5 to 102.5.
We're at 100.8.
Perfect! So we're doing good on the physical exam. We're also going to look in her ears and make sure that we don't see any growths, any gunk, any funk. any irritation. We use this otoscope here. And we look pretty good. And I smell this too because I'm weird. Not really. I smell it because it gives me an idea as to whether there's an infection in there, even in the absence of gunk or funk. So everything checks out good. So now what we're going to do is I'm going to leave and get my glasses. Pull some blood now. So the best place to pull blood in a pet is the jugular vein. This is not easy to do. Hopefully I'll make this look easy, but it's not. So I'm feeling here. A lot of what we do is by feel. And so I was feeling right here, and hopefully I got it. So it's just a matter of practice. I've been doing this for 23 years. Not easy to do. Not every veterinarian can do that. And if not, there are other places in the front arm, back leg that we can actually take blood from. But this blood is going to be used for a heartworm test, and we're also going to send it to the lab to check liver, kidney, pancreas, all those good functions to make sure that we're okay. And this also will give the dog permission to have a dental. If everything looks good, then he can have his teeth cleaned, because we have to sedate them and intubate them to clean their teeth. These are all the shots that he's going to get, and we're going to go over the shots too. The shots that dogs get annually, one, generically it's called a Distemper Parvo vaccine. And there are actually 5 or 6 different things in this vaccine. We just call it a Distemper Parvo, but Distemper is very important to prevent. Parvo is important to prevent hepatitis, leptospira, corona, many different things. Influenza in this vaccine that we try to prevent. And the reason why we don't see that much Distemper and Parvo is because what? We vaccinate. So go get your COVID shot so we can stop seeing COVID and we can get on with our lives. Okay, that was a little side note.
A little PSA.
As soon as I can get mine, I'm getting it, okay? I'm putting just a little bit of Benadryl in these shots because this pet is getting a lot of shots today. And I'm mobile, and I definitely don't want him to have a vaccine or her to have a vaccine reaction. And I don't know if I have time to come back. So let's go ahead and prevent it. We're going to give her a little Benadryl as prevention. Oh, shake it off.
Yeah.
Shake it off. That one was influenza. This one on the right side is rabies, and I put this on the right side because if this pet has a reaction to a vaccine, giving her 4 vaccines, how do I know which one is causing a reaction? Well, if I keep them in the same place, rabies on the right, distemper on the left, then I kind of know. This one is the kennel cough shot. I'm sorry, Bisou. Little stick, last stick.
Good
there
job.
we go.
Good job,
Shots
puppy.
are done. You took it like a trooper. Okay, last thing you're going to have to take is we're going to have to do a fecal exam. So I don't know if you all realize how we get a fecal sample from your pet. You can bring it in, which is good if it's fresh. But we also can use this. And we lube this up, and we pretty much put this right up her butt and get a sample. And that's it. Look how quick and easy that was.
Job.
That was not bad at all. So the owner's concerned about one of the nails. And so we're going to check these out. Now, this is something that most clients hate to do. You hate to trim the nails, and I do not blame you. But the truth of the matter is, the longer the nail grows, the longer the vessel grows, and the less you can cut off. So you have to cut these nails. Even if you just cut the tip off. See that? They don't like it because there's also a nerve right next to this vessel, and they can feel this. But you have to at least cut the tip of the nail off once a week just to push the vessel and the nerve back. And grinding them does not help. They have to be cut first, and then they can be ground. Grinding just kind of rounds the end. It doesn't cut anything back. So that's about all I can cut off without her nail bleeding today. And I'll be honest with you, I'm just taking an educated guess. These nails are dark in color. I can't see the vessel because I really don't know. Now that nail is a rogue nail. It's pretty long. So I'm going to try to take a little bit more off of this one. It's okay. Nobody likes the nail trim. But I can't really cut much. This one's curving around. And that's the thing. When they start curving around like this, what will happen is this thing will keep curving and growing to the pad. And then you have a $300 nail trim versus a $15 nail trim. So make sure you cut these nails, because if they grow into the pad, that is a veterinary visit and an emergency, and antibiotics and pain medicine and everything that you just can avoid if you just cut the nails. I didn't get her. I didn't quick her. She just tired. She's over all this. So let's turn her around and I'll do the other side. So yeah, I'm just going to take the very tip off because I can't take any more off because the quick is right here. Actually, this one I can see, and it'll be a mess if I do. Don't forget about this little sidewinder. That's what I call it. It's a little thumb. You forget about that, that will grow into a circle, and you'll have a serious medical bill. Don't do it. You can do this. You put your pet up on a table like this with a towel down, and they'll think they're at the vet. And you can do this. Trust me. If you end up cutting them too short and they bleed, just apply some pressure. It's not going to kill the dog. You can even get some, what's it called? Now, let's turn her around and let's look at something here. This is something easy to see. Now, when we look at the front legs, what do we see here? What's different? Do you remember that game we used to play when we were kids? What's different in this picture versus the other picture? Well, the difference is this. See this discoloration right here? That's not because she has a nice little beauty mark. It's because she's licking this. The acid from her mouth is discoloring this area. So this is an area of concern. So this would draw my attention here to try to see why is she licking it. So I don't really see a real reason. There's no skin irritation here, and maybe she's obsessive compulsive. I think I would err on that side of her being obsessive compulsive. Some dogs get bored and they lick. Also, some dogs their mouth hurts because they have periodontal disease, and that's how they soothe themselves. So I don't see anything frank right here, like there's no growth, there's no skin irritation, but I do know she's licking her hair right here, and I would definitely suggest that he consider a dental just to make sure we're covering all bases. So another thing that this owner is concerned about is the hair that is growing right around her eyes, and it leaves like a little clump right here. And this little clump of acid from her eyes can cause a skin irritation right here. So what I'm going to do is I'm going to lift up this clump here, put my finger over her eye, and I'm going to cut the hair away. And there is an underlying skin irritation here, and that's what happens when this hair, and it seems to bother her. You know, this little hair will sit here and see how red it is underneath. That's from this hair sitting there and the tears causing an infection. So we have to always remove this hair, and I'm going to give her some drops for this because this is really irritated. But if he keeps this hair cut here, he will be a winner. Okay? These are important tips to prevent a veterinary visit. So even on this side, I'm getting willy-nilly with these scissors, but you don't try this at home, and if you do, put your finger over the eyeball so you don't inadvertently stab the eyeball, because that can happen and then you'll be mad at me. Don't be mad at me. I'm trying to help. Hold on, Bisou. Hold on, honey. I know it. It's so weird. It is so weird. So see all this hair right here? We're gonna try, if she'll stay still, to cut this away. Okay? This will make her feel better. If you cut this hair away, you won't have this underlying infection. And that's what she has. She has an underlying infection, and it probably hurts. It's like a raw skin area. So don't let this hair sit here. Make it short. A lot of people like to keep hair here. They like their dogs to have these long lashes. All that is a veterinary bill waiting to happen. I know they're cute, but we're in COVID. Nobody's looking at your dog right now. Okay, so one way that you can help clean this up is to use some saline solution. So I'm going to get some saline solution here. Look, I buy mine at Target, okay? Saline solution, salt water. Best thing. Let me get some dry gauze, please. And what you can do is you can flush the eye out with some saline. Salt water will heal anything, right? So you can just take the saline. I would get rid of the first little bit just in case. And just look, I'm just flushing it. If you get this in the eye, it's not going to hurt a thing. See that? And this salt water will help to heal this pretty fast. Right? You see that irritation there? From the hair just sitting there. I think I can even remove more hair. So I'm going to go for it. Why not? She feels better now. So that's why she's letting me do it. I think that saline made her feel better. Okay. And I know you probably won't have this, but I'm going to use an antibiotic drop here. And I'm going to sell him some so we can get that to heal up. And then we're going to do the other side. You can take a piece of gauze. If you don't have gauze, look, use a washcloth, white washcloth or something, and keep that area clean. Okay? But saline twice a day till that looks perfect. Should be fine. And then keep the hair cut. You'll be fine. Okay? Just don't stab your dog's eye. And if you do, it's on you. I tried to tell you.
But call us.
But call us if you need us, okay? Okay, so those are some good husbandry tips, I think, and some good preventative things that you can do to help your pet. But this was just an annual exam. This is what we do at the Pet Fixer. See you later. Bye-bye.